Hello, my name is Jose Maria Torres Bravo. The topic I'm going to talk about is shoulder internal rotation passive range of motion values in the side lean and semi-sidelying position. Definition. Passive movements are administered on a regular basis for the treatment and prevention of contractures. They are considered passive because the patient does not make any effort. The physiotherapist is in charge of performing the movement. The main objective of the passive movement is to improve the mobility of the joint to perform the movement of internal rotation of the shoulder passively. The shoulder must be in abduction of 90 degrees in the body plane and the elbow flex to 0 degrees. The explorer should exert some pressure on the shoulder to stabilize scapula on the examination table and achieve a more accurate measurement.
In this position, with the patient lying supine, we're going to abduct the shoulder to 90 degrees, flex the elbow to 90 degrees, and in this position, in this case utilizing a towel, maintain the humerus in a neutral parallel position to the table. This is going to set us up for measuring external rotation at the shoulder. Our landmarks are going to be the olecranon process, and our moving arm will go up to the styloid process of the ulna. Our stationary arm will be from the axis perpendicular to the floor. In this position, I'm going to stabilize at the proximal humerus and allow the patient to externally rotate, looking for any type of rocking or anterior motion that would indicate an end of the patient's available external rotation. In this measure, many times, particularly in patients in throwing sports, you may see range of motion that is well beyond 90 degrees in this position. In that case, you need to maintain this forearm clear of the table to allow to measuring below the level of the table in this direction. So make sure that you're not just measuring the arm hitting the table. In this particular measure, I feel an anterior rocking. That would be the end of the range. I can get my goniometer. We're going to go perpendicular to the floor and then measure along this line. And that would give us an accurate measure of external rotation of the shoulder.
Application in physical therapy. Passive exercises are necessary to maintain the osteomuscular system of the bedridden patient as well as possible, avoiding muscle atrophy and improving joint mobility. The movement of internal rotation of the shoulder is usually performed in the supine position. When performed internal lateral position will be to stretch and straighten the muscle because the movement is against gravity. The patient is placed on the affected shoulder with a posterior tilt of 20 degrees to 30 degrees. With this position, the stabilization of the scapula is achieved and decrease the symptoms of subacromial impingement. The shoulder and elbow are flexed to 90 degrees and the internal rotation begins to be facilitated. It is explained to the patient to apply a slide for on the bridge, or the same patient can do it with the opposite joint. The patient may experience the sensation of stretching the that comes of the shoulder and should stop the movement before pain is generated. Pros and cons. Pros. About stiffness, improve muscle nutrition and promote blood and lymphatic circulation. Uh, Prevent addiction and contractures of tissues and maintain their elasticity. Maintain joint mobility. Cons. May create discomfort in patients with acromial impingement. Perform movement in lateral position equivalent to greater energy expenditure for the physical therapy.
Hello, and welcome to another edition of Orthopedic Sports Medicine Patient Educational Series with Dr. Adam Jarecki. In this video, we're going to explore some of the different passive range of motion exercises and stretches that we expect that you will be doing following your shoulder surgery. Whether it be a surgery on your rotator cuff or a biceps tendon or your labrum, at some point we're going to be getting you out of your sling and start moving your shoulder. Oftentimes this is going to be during a period where only passive range of motion is allowed. Passive range of motion means that someone or something else is lifting your arm up above your head. So for example, if I am just lifting my arm by myself, this is called active range of motion exercises or independent range of motion. For many types of shoulder surgery, as we attempt to try to regain range of motion following discontinuation of your sling, we want to avoid active range of motion exercises so as to not put too much stress on your repair. Once we remove the sling, we will usually start you in formal outpatient physical therapy. The therapist will be pushing and stretching your arm up above your head, up and out to the side, as well as working to stretch it and rotating it out and rotating it back in. However, you are only in physical therapy typically for 3 days a week, which means that on the other 4 days a week, you need to be doing a home exercise program to be working on your passive range of motion every single day. The full restoration of passive range of motion of the shoulder is by far the biggest hurdle for patients to achieve following their shoulder surgery. And residual or long-term postoperative stiffness following shoulder surgery is one of the most common complications. Because of that, it is crucial that you understand your home exercise program and how to do your passive stretching of your shoulder every single day. Once it is safe to come out of the sling and start your stretching exercises, we want to be doing this right away, every day, so as not to develop stiffness in the shoulder following surgery. There are two main exercises that I'm going to go over in this video regarding passive elevation of the shoulder. So in other words, getting the arm all the way up above your head without using your own power. These exercises include tabletop exercises as well as wall walks. Both of these can help in assisting patients to get their arm above their head without using their own muscles. So let's start with tabletop exercises. The exam bed here is going to act as my tabletop, but you can certainly use just your dining room table or a countertop in the kitchen. And what we want to work on is two primary forms of elevation of the arm. Both forward flexion, which means that the arm is coming out above your head in front of your body, as well as abduction, which means that the shoulder or the arm is coming out up above your head out to the side of your body. So for forward flexion exercises with your tabletop exercises, you're simply going to place the arm onto your tabletop, and as you lean your body forward, you're going to use your body weight in order to slowly push the arm and stretch it up above your head. As you lean further and further, you get closer to all the way above your head. You can then slowly walk it back up and control it all the way. The second elevation with tabletop exercises is abduction. For abduction, you want to come to the side of the table so that you are leaning out to the side of your body. And then you will simply be leaning in out to the side with your body weight to push the shoulder up and above your head. Once you are done, you can slowly start bringing it up in a slow and controlled fashion. When you get to a point where it feels like there is a lot of resistance and a lot of pain or discomfort, this is the end point. And so you want to hold that end point for 20 seconds and then come back out. We want slow and controlled stretches with sustained stretch at your maximum height of your arm. The second type of home exercises that you can do to achieve full passive elevation of the arm, both in forward flexion and abduction, are called wall walks. And again, like a tabletop slide, you don't need any special equipment in order to perform these stretches. We're simply going to use a flat surface of the wall to help assist in using your body weight to push the arm up above your head. So again, in forward flexion for a wall walk, you're going to be facing the wall. And you want to use your fingers and simply walk the arm up the wall until you get it to a position where you can then start sliding your arm by leaning your body weight in to create the stretch and the power to get the arm all the way above the head, again without using your own muscles. And you just simply reach higher and higher until that arm is all the way up. Like the tabletops, you want to hold it at the top to get a good sustained stretch. You then want to bring it back down in a slow and controlled fashion until you are all the way back down to your side. You then want to repeat those exercises in abduction, which again is out to the side of your body. So you simply want to walk your arm up the wall until you can get it to slide, and then lean in with your body weight to stretch the arm out to the side of your body all the way above your head. Again, once you get to the top of your range of motion, you want to hold it for a 20-second count for a good sustained stretch. You then can slowly bring the arm down in a controlled fashion until it is to your side. I recommend that patients do these exercises multiple times per day in order to achieve full range of motion of their shoulder. Now let's look at some rotational exercises that you can do to get internal and external rotation of the shoulder with passive range of motion exercises. Now let's look at passive external rotation stretches. The therapist might have taught you the exercise where you hold a broomstick and you push with your good arm, stretching or rotating your bad arm out away from your body. There are a number of different ways to isolate external rotation in stretches. I like to talk about placing the arm into an open doorway or placing the arm up against the side of a countertop in order to achieve the same goal. For this particular stretch, it is key that you isolate only external rotation. So as you are rotating your arm out away from your body, you want your elbow to stay tight up against your body, as opposed to doing one of these, which is cheating, okay? And so what I teach patients is to hold the elbow up against the body and then place the arm into an open doorway. You can then simply rotate your body out away from that doorway, isolating the arm to rotate into external rotation. Again, like the elevation exercises, when you get to the extreme of external rotation for you, you want to hold it for a slow, sustained stretch for 20 seconds and then come back around. Oftentimes patients do much better with their elevation than they do their rotation. And it's not uncommon for patients to get full elevation of their shoulder but still have pain or symptoms in the shoulder because of associated rotational stiffness. So it's important to identify residual stiffness specifically in the areas of internal or external rotation. If we've identified stiffness in external rotation in you, this will be a key exercise for you moving forward in order to achieve full range of motion of your shoulder. Now we're going to talk about internal rotation stretching. This is oftentimes the stretch where you're bringing your arm back behind your back and can be one of the last ranges of motion for patients to get back. Oftentimes the therapist will have you doing stretches back behind your back. Perhaps you're throwing a towel up behind your back and using your other arm to lift your surgical arm back behind your back. All of this is done in an attempt to try to increase your passive internal rotation of the shoulder. In addition to that, as part of your home exercise program, I like to teach patients something called a sleeper stretch. To help us with the sleeper stretch today, I've enlisted the help of Carrie to demonstrate how we do these stretches. I personally feel as though the sleeper stretches are a little easier to do just because it is a stretch that you are able to do more out in front of your body, and so it's just a little easier for you to see your progress and to see the arm as you are doing your stretches. So in order to do a sleeper stretch, you simply lay on your operative side. So in this case, Carrie, we're working on her right shoulder. So she lays on the right shoulder. And the key is that all of the angles of your body need to be at right angles, which means 90 degrees. So in other words, I tell patients that the back needs to be straight up and down at 90 degrees. We then bring the operative arm out away from the body, 90 degrees, and then the elbow straight up and down at 90 degrees. And so this gives us isolation of just internal rotation. And what I have patients then do is use their opposite arm to help push down the palm towards the floor or towards the bed or whatever you're laying on. And this, you're going to feel it pulling in the back of the shoulder as you're working internal rotation. I always compare your internal rotation with your sleeper stretches to your other arm, and the goal is always to reestablish internal rotation of the shoulder equal to that of your other arm. These exercises do not need any special equipment. I recommend that you just simply lay in the living room carpet or on a bed in order to perform these stretches. I hope this video has helped you to better understand some of the home exercises required to achieve full passive range of motion of your shoulder following shoulder surgery. These exercises are perhaps one of the most important thing for patients to fully embrace and to do on a daily basis in order to avoid the very common postoperative complication of shoulder stiffness. I hope you've enjoyed this video. Have a good day.
All right, so this is one technique you can use to improve internal rotation range of motion at the shoulder. We're going to use a type of stretching called PNF stretching. Stands for proprioceptive neuromuscular facilitation. You don't have to be able to spell it to do it, but the idea is that we're going to alternate a stretch with a contraction of the same muscle. Because what you can find is that some muscles, their range of motion will be inhibited if you're incredibly weak or unstable in that part of the range of motion. And what we want to do is just sort of tell your nervous system and your brain that there is some stability there, so it allows you to go into that range of motion. Again, it's not always a stretch, stretch, stretch kind of idea, but we want to create just, are we stable or are we strong in that part of the range of motion too? So I'm on my side. I want to make sure I've got some decent posture here. I don't want to be real slumped up because that tends to just jam the upper arm right up into the shoulder, and it's not gonna feel great. So I want to have some decent posture. I'm laying on my side, and I've got this arm, give or take, about 90 degrees out from the shoulder. And all I want to do is I'm going to gently apply some pressure right at the wrist, not even at the hand, but at the wrist, and just push this arm now into internal rotation. And then once I find that end range, and I haven't even started to force it yet, and I don't want to, so I've got that muscle in end range. Now what I'm going to do is I'm holding my hand here. Now I'm going to push this arm back into this hand to create some tension now on the external rotator muscles of the shoulder, which are the muscles that would be tight if I can't get into internal rotation. So I'm pushing this arm back, and I'm only going to hold it for about a 10 count. So 2, 3, 4, 5, 6, 7, 8, 9, 10. Now I just want to apply a little bit of just a gentle push to move that muscle now into the end range again. You see it's able to go just a little bit further. And again, I'm going to do a 10-second push. All I'm trying to do is just get that muscle to actually fire in that end range, because sometimes that's the reason why your brain doesn't want you to go into that range of motions, because there is no support. And then I relax and I'm able to go a little further. Again, I'm not forcing this. I barely have a stretch on the back side of my shoulder. And then again, now I'm pushing back. It's kind of like you're alternating maybe like a 5 to 10 second stretch with a 5 to 10 second contraction, until you reach the end range. End range might be palm on the floor, or it might just be an improvement from where you started. You know, especially if you're really tight, don't expect that you're going to get 100% turnover within a single day. But even if it's an improvement over where you started, then that's really all that matters. So now do one last push, and we'll kind of see where we ended. And you want to end with the contraction. You don't want to end with the stretch, because you're trying to just lock in mentally that sort of stability angle of it. Okay, so again, it's not going from 90 degrees all the way down to 180 degrees, but still even picking up 10, 15 degrees worth of range of motion in what amounts to probably less than a minute of work is a super valuable thing to do, especially because that might be if you were to hold a stretch, that might be your first 5 minutes of holding that stretch. But now that I've actually fired some of that supporting tissue up, now if I were to apply some harder stretching, I've gotten past where I'm unstable, and now I can actually get to where I'm a little bit more on the tighter side. And that way I'm getting more benefit from the traditional, more static stretching kind of concept. So there you go.
Conclusion. The passive movement of shoulder internal rotation is not recommended in lateral and semi-lateral position. It is an exercise expenditure of energy to perform in against gravity, because the passive movement is performed by physical therapy, and it would be more effective to perform it in supine position.